Hello, I'm Jalen from Medebound, and we have recently conducted multiple cases of MD Anderson Cancer Center's teleconsultation and medical visits to the United States. Today, I will provide you with a detailed comparison of the advantages and disadvantages of both traveling to the US and teleconsultation for medical care, as well as some factors to consider. Help patients make sound medical decisions. For patients when to choose the second consultation, when to go to the United States for treatment, need to consider the following factors. First, the feasibility and effectiveness of the treatment plan. The advantage of choosing remote consultation is to be able to access the expertise and experience of US doctors to help patients get a more accurate diagnosis and treatment plan, and at the same time to avoid the cost of going to the US for treatment and time costs. However, there are some treatment options that may need to be performed in the US, and then it is necessary to consider traveling to the US for treatment. For example, we helped a brain tumor patient to participate in a clinical trial in the US and was successfully enrolled. Second, the nature and extent of the disease. If the patient's disease is rare or serious and requires complex surgery and new drugs, treatment in the US may be more appropriate. If the disease is relatively mild or needs to further listen to multiple diagnostic and treatment advice, remote consultation may be more appropriate. Third, the patient's personal situation. Choose to go to the United States for treatment requires patients to have a certain level of physical fitness and economic strength, as well as the need to consider the visa and other aspects of the problem. The choice of remote consultation is relatively more convenient. The patient only needs to have a network connection and equipment to receive diagnosis and treatment services. However, going to the US and teleconsultation are complementary, and patients should consider them according to their own situation and needs, and they can complement and transform each other. We once helped a patient with spinal muscular atrophy, SMA, to get a treatment solution through remote teleconsultation with an American expert, and then decided to go to the US for treatment and successfully traveled to the US with Medebound's assistance. Therefore, patients can choose the right treatment for themselves according to their own situation and needs, and at the same time choose the right medical service organization, such as Medebound, to obtain comprehensive medical consulting services and support to help better complete medical treatment and rehabilitation. Follow me for more overseas medical information.